Today we're going to focus on two separate skills. The first skill is going to be the administration of an IV push medication, which may be abbreviated IVP. The other skill that we're going to focus on is the administration of an IV piggyback, or you may see that abbreviated IVPB. Typically with both of these skills, the patient already has an IV started. Most of the time they may have just the saline lock, which you may also hear called medication lock. An older term may be heparin lock, which you may still see used in some facilities. So the first thing that we're going to focus on today is the administration of medication through the saline lock. So again, the patient has the saline lock previously started, or in some instances you may have to start the IV prior to administering the medication. That's a separate skill that we'll focus on either before this or later on. So the first thing that we need to do is get all of our supplies ready. Depending on your medication room or your facility, you may prepare the medication either in the medication room or at the patient's bedside. So that you'll have to decide what is appropriate for your facility. So in looking at your lab manual, we're going to go through the steps of administration of medication through a saline lock. So the first thing is identify the patient. Of course, everyone knows this is one of the most critical steps when you're administering any kind of medication. So we're going to not only ask the patient their name and their birth date, but we're also going to compare that to the MAR, the Medication Administration Record, and compare that to their ID bracelet. The second step is to confirm the order. So again, any type of medication that we administer as a nurse must be ordered by a physician or other healthcare provider. So we need to make sure that we have the correct order and make sure that it does say administer the medication through the IVP or IV piggyback route. Next thing that we need to do is acquire the medication. So you need to get your vial or your medication out of either your Pyxis or your medication card, again, depending on your facility. Again, we need to check our label and do our checks 3 times just as we do any other medication. So for this demonstration today, I'm going to be administering Lasix 20 milligrams through the IV push route. Also, regarding this medication, when you are administering IV push medications, you need to understand how to administer the medications. The best method of getting that information is with an intravenous medication drug book. This medication will let you know all the details about how fast to push a medication, as well as indications, side effects. Anything that has to deal with IV medications is located in this book. So anytime you want to administer an IV push or an IV piggyback medication, you need to always refer to this book. Therefore, prior to going into the patient's room, or if you're doing this in clinical with your instructor, you need to refer to this book and see how long you need to push this medication over. And we'll go over that more in detail in class. Then the last step of number 1 is to explain the procedure to the patient. Again, this goes for every procedure that we as nurses do, is to make sure that the patient is informed and understands what's happening. For this instance, they may get scared and nervous because it deals with the IV route. However, they already have the IV started in most instances, so you're just going to inform them that you're going to be putting medication through that medication lock, saline lock that is already located in an extremity. The second step, of course, is washing our hands. Again, no matter what skill we always perform, washing our hands is also very crucial. Number 3 says clean the port for 5 seconds with alcohol and apply gloves. You could either put on the gloves before you apply the alcohol, or you can apply the alcohol first. It's up to you. So we're going to get some non-sterile gloves. We're going to place them on. Next, we're going to take our alcohol prep and we are going to clean the port of the saline lock for 5 seconds. In some instances, they have the scrub hub, and so for that instance, if that facility uses that piece of equipment, we would use that. Okay. Next, we are going to take our normal saline and we are going to flush this saline lock. The reason behind the first flush is to determine that our IV is patent. We don't want to be administering medications into the intravenous system if it is not a patent IV. Otherwise, that medication is just going to go into the surrounding tissues and not go into the venous system to go up through the heart and then back and through the body. So after we've cleaned, we're going to attach our saline flush. And again, this can either be a prepared one, as I have here, or in some facilities you may have to actually draw up the medication or the saline from the vial itself into a syringe. This one's a prepared one. And your lab book says to flush with 1 to 5 milliliters of normal saline over 1 to 5 minutes. Again, depending on your facility, you may push 1, you may push 5. So again, you need to know your facility's policy. What is their policy on flushing with saline? How much is appropriate? Just for demonstration purposes and for time purposes, we're going to push 1 milliliter. The rule for pushing normal saline is 1 milliliter of normal saline per 1 minute. Therefore, if your facility says to push 5 milliliters, then that would take you 5 minutes. So we're going to attach our saline to the saline lock. We're going to aspirate to see if we get blood return. For saline locks, you may or may not get blood return. That doesn't necessarily mean that you have a patent IV if you don't get it, blood return. But we're going to pull back. Next thing we're going to do is we're going to flush, again, that 1 milliliter over 1 minute. What we want to feel for is that lack of resistance. If your IV is not patent, you will have difficulty in pushing the medication. It'll feel like it's not going anywhere. So just really slowly we're going to push. If you do feel resistance, you want to stop, take the saline off of that, and restart your IV. For this instance, it's pushing very smoothly. I don't have to put a lot of force. I can also look at my site. I don't see any swelling that's occurring while I'm pushing the medication. So again, I'm going to push 1 milliliter over 1 minute. For time purposes, we're going to say that it's been a minute. So next we're going to take it off. Lie it down to the side, put the cap back on it. The next thing is we're going to pull up our medication. And again, it can be a pre-filled syringe or you may have to pull it up. For our demonstration today, we're going to be giving 20 milligrams, and our vial says that it's 20 milligrams in 1 milliliter. So again, you may have to be doing some math problems. So for this instance, we're going to pull up 1 milliliter. Put our 1 milliliter of air in, draw out our 1 milliliter of medication. We do not want any air in here since we are going into the venous system. So I have my 1 milliliter of my medication. Again, we're going to use the drop method to put the top back on. If we have pulled this up into the med room, then again we want to make sure that it's covered. If we look up furosemide or Lasix in our drug book, it will tell us again how fast. And again, we want to do this before we go into the patient's room so that we appear to know what we're doing when we're talking to patients. So if you look at the rate of administration for furosemide or Lasix, it says that 40 milligrams can be given over 1 to 2 minutes. We're given 20 milligrams, so we could half that, so 30 seconds to a minute. So I'm going to place this over to the side. Again, I'm going to clean my port for 5 seconds. Then, because we're dealing with a needleless system, we're going to take the needle off. Place it to the side. Place our syringe on the saline lock. And again, I'm going to time myself giving this medication over either the 30 seconds or the 1 minute. I tend to go for the longer period of time just to make sure that we're safe. Typically, when I'm administering medication over a certain time period, I hold my watch close to it. And you can either divide it up. Say if we're giving 1 milliliter over a minute, we may do 1/4 of a milliliter every 15 seconds. Or you can just kind of space it along that full minute. So again, it's up to you on what you're comfortable with. So I'm watching my watch. I'm going to push it over the appropriate time. And again, for time purposes, we're going to say that it's been a full minute. I'm going to take it off. Okay. The next thing, we need to push some more saline into the saline lock. The reason behind this second saline flush is because our medication, when we ended our push, we still have medication in the tubing. We want the patient to get the full amount of medication. Therefore, we need to flush it with some saline in order to push the rest of that medication on into that venous system. So again, we're going to clean. We clean anytime we are getting ready to attach anything to the saline lock, 5 seconds. We're going to apply our saline flush, and this time we talked about in the first flush that we're going to push that 1 milliliter over 1 minute. For the second push, because what we're actually pushing is the medication into the patient, we want to push it at the same rate that we push the medication. Therefore, we pushed one medication over 30 seconds to a minute, so therefore we want to go about another minute with this. The amount that you push, again, is going to be determined by the facility. Again, it can be anywhere from about 1 to 5 milliliters. Again, for demonstration purposes, we're just going to do the 1 milliliter, which is what you'll do for checkoff. So again, we're holding our watch close. We're dividing it up again if you want to do the 1/4 of a milliliter over 15 seconds, again, whatever you prefer. Just nice and slow, and again, the purpose of this is to push that rest of that medication. So we're going to say that we have pushed the medication over the 1 minute. We're going to take our saline flush off, and again, we need to clean up our supplies. So our saline flush and our medication syringe, those are going to go into the sharps. The vial, if it's glass, it's also going into the sharps. Unless it's a multi-use vial, then we would keep it for further use. Any kind of needles would also go into the sharps bin. Our alcohol preps, we're going to take that and take our gloves off. We're going to wash our hands, and then we're going to make sure that we document. Again, following the rules of documentation, if it is a routine order, then that just needs to be charted on the MAR. However, if it's a stat, a one-time order, or a PRN, then we need to make sure that we're documenting not only in the MAR, but also in the nurse's notes as well. Also, for this skill, if a patient just has a saline lock, they could also have an IV piggyback hung directly into the saline lock. So that will be something we'll focus on a little bit more at a different time with the administration of an IV piggyback.